Hey, so today is day 2 post-surgery and I'm still feeling pretty good. Still feeling okay about the whole thing, which is good as well really because we can't go back on it. I haven't really had any upsets or anything like that. The only when I talk about grief and the loss of the leg, that does make me upset because I've still got the grief thing going on, but that's to be expected, and I'm expecting that to carry on for quite some time, and the roller coaster of emotions. But on the whole, I'm feeling okay. Everybody is remarking on how well I'm looking, considering how soon it is after surgery. So what happened? The surgeon came around and the vascular registrar, and they talked about the surgery. Now they said that I have good muscle mass and good tissue, so that meant that the cushioning on the end of the bone is good and the tissues are good. But what they did mention is that when they closed off all the arteries in the lower leg to remove the lower leg, there was really very little, if any, blood flow in the lower leg at all, which just tells me that, well, of course we did the right thing, because there was no blood flow really. Usually you would expect if an artery is severed, you would expect spurting, and there was not. So that's what terrible state my lower leg was in. Sorry, tea arrived. So yes, that just goes to show what a state my lower leg was actually in. There was no blood flow, and there was no bleeding in the surgery. So all in all, feeling all right. They were really stoked that I was feeling so good. The anaesthetist came around as well and talked to me about that and said that good management of anaesthetic and pain beforehand would mean that the phantom pain and things like that afterwards would be reduced, which is the opposite of what the surgeon had said. But I don't know, he's done anaesthetics on a lot more varied surgeries, so I hope he's right, because he said that a planned amputation is likely to produce less phantom pain than a traumatic amputation, and he said that research shows a lot of it is in mindset, so psychologists can help fix that if it happens. Now I haven't had any phantom pain yet, but during the night I did feel like my left foot, that I don't have anymore, had pins and needles, and that's a bit weird when you know it's not there but you feel like it's there. But I haven't had any pain, so it hasn't caused me any problems. I haven't had to use the PCA, the button, at all, so that's making me feel happy. And we talked about the transition onto oral meds, so that scares me a little, because they have to turn this off and take it out, and it's just like pink, it stops. We can't do a transition, so they've started me back on the pregabalin, which is the nerve pain meds I was having before. We started at a low dose and we're going to increase it gradually, but there might be a couple of days of meat in between once we get it right. But I suppose that's to be expected. Yeah, they did chop my leg off, so you're going to have some pain. But at the moment, I don't have any. And I've started to work on some movement of the leg, to get the muscles more moving, because I know that bed rest really degenerates the muscles really fast. I've learnt this before, and so I know that I've got to get exercising. Now, the surgeon came round, and so did the physio, and we're absolutely not allowed to move off this bed for 5 days. So the first time they can get me anywhere is Tuesday. Now the physio wanted it to be sooner. I wanted it to be sooner. The surgeon is hard and fast no, that I must be on bed rest before then. The reason for that is because of my increased muscle mass, more than your average 80-year-old that might be in this position, puts the skin under more stretch where they did the closure, so they want to be careful with it that I don't pop the sutures. Now if I do and they have to do a revision, more and more of my leg gets removed, so we do not want that. So although I'm a bit pissed off about having to stay here in bed for all that time, I know it's probably the right thing to do. The other thing that I found hard today, I still can't wrap my head around this, is that they don't want me on crutches for 3 months. So that means wheelchair for 3 months. So that means my house needs to be adapted before they'll let me leave. Now I've been trying to ask for the OT all the way along, and they've told me no, it has to happen afterwards. So when the physio came round, I pushed for this, and they've referred to the OT because they won't let me go out of hospital unless I can get around the house, and I can't get into the house in a wheelchair unless they put a ramp in. So that's my next little battle that I'm having to face at the moment, which is the bit. Anyway, all in all, it's not been too bad a day. I've got no visitors and no patients in this room now. They've all left today, so maybe I'll get a quiet night's sleep, maybe. But other than that, I'm feeling okay, still feeling okay. I know it'll hit me in things when I have to sit in a wheelchair and when I struggle to mobilise and them sorts of things. But we'll deal with that when it comes. I want to stay positive because that's the only way to make progress, the maximum amount of progress that is possible with the limitations that I've got. So I'm going to finish with the bedside exercise routine. Now, I was really keen on getting the muscles working whilst I'm on bed rest so I don't lose too much muscle mass. And until today, I could not move this leg at all. So I've been working on that. And I remember having this problem after the knee replacement. The quad was really hard to reactivate. So I've been working really hard. I'm going to show you my short, sweet bed-bound exercise routine, and there's a warning just before the end where I'm including the amputated limb. It's not exposed, there's still a bandage over the end of it, but I'm putting the warning in there before that happens just in case you don't want to look. It's the last thing that's on this video, and the exercise routine finishes the video. So if you don't want to see the amputated limb, then just stop the video when you get the warning screen. Have a great evening. I'll see you soon. Warning, the next set of videos show the bandaged amputated limb. If you don't want to look, stop the video now.